I think the main points that we had was, number one, that innovation is really important for surgery in general and cardiothoracic surgery as well. The second part of it, though, is regarding how we innovate and how it's possible to proceed. So when we think about innovation in cardiac surgery, but also in surgery in general, I break it down into, there's conceptual innovation. Conceptual innovation is innovation that has its basis in an improved knowledge base of both anatomy and physiology. So therefore, we can take that improved knowledge, that improved understanding, and then design operations that we couldn't design before. Now, the other area that's really important in certain specialties like cardiac surgery, maybe orthopedics, and other specialties that are what we call device intensive or device driven, is innovation in devices. And the question is how these new therapies regarding devices can improve patient care, and then we can devise operations with these new devices. And the third area really is not a third area; it's a combination of these two, which is to take a conceptual leap and start applying devices in different areas than they originally intended, but that can be then further refined or designed so that we can use the combination of a new therapy with a new device and a new concept. At the level of the department and the division, this is critical, is to have a culture, is to develop a culture of innovation, a culture of early adoption within divisions and departments of surgery and cardiac surgery. This is really important and is maybe focused on some of the leaders, some people who have a little bit of gray hair. So we have to develop that there's no fear of failure. Okay, we have to have an audit function. In other words, we can't have people going out and doing things that are bad for patients. Another important concept is that of early adoption. Now, early adoption of techniques is a bit different than purely innovative. It does require a culture of early adoption and the fact that you should have no fear of failure. But early adoption is very important. And the reason why early adoption, especially at the level of the trials, of the clinical trials for new devices, for example, or new operations, is really important because that's where the culture of the conduct of the operation, or the culture of the operation, or the culture of the use is made. So, for example, in transcatheter aortic valve surgery, which was very disruptive, totally disruptive technology, and radical and revolutionary, the operation was done with interventional cardiologists and cardiac surgeons. So, and that paradigm, that culture was developed during the trials. It was developed during the early adoption of the clinical trials, and now is standard in practice across the United States of America. So it's very, very important to be involved in the early trials of major new therapies.